podcast. Check it out.
The Joe Rogan Experience.
Train by day, Joe Rogan podcast by night, all day.
All right, Joe, now that we're back from our break, what questions do you have about the science behind SIDS?
Okay, so how does this syndrome actually work? Like, what's going on biologically?
Great question, Joe. Due to difficulty researching SIDS pathology, we have a hard time understanding exactly what is happening. This, however, does not mean we have no information to go off of. Researchers have formed theories that seem to follow what evidence suggests.
Pathology? Are you referring to how SIDS works?
Yes, Joe. Without the ability to monitor every marker while such an attack is happening, it makes it difficult to understand it exactly. There has been progress made in the development of the triple risk model by Filiano and Kinney in 1994.
Triple risk model. Interesting. How exactly can that explain SIDS?
Well, first, Joe, to put it simply, it describes three separate occurrences that on their own would not be life-threatening. However, when these overlap and happen all at once, there is a significant increase in the risk of SIDS. It's easy to understand with the infographic you brought along. I got this, Joe. Hey, Jamie, can you put it up on the camera?
Can you guys explain each of these different zones more in depth?
Absolutely, Joe. First, we'll start off with the vulnerable infant zone. This is describing unknown or undiscovered medical conditions involving the brain or genetics that affect the infant's heart rate or breathing.
Surely, with all the technology in medicine today, we could see these conditions before too long.
Well, in most cases, the conditions aren't enough to cause many health issues in infants, as they can typically adjust to stresses. This, along with the fact that the specific conditions are difficult to find, even when the symptoms are obvious, makes them difficult to find ahead of time.
So these unknown medical conditions, while they do affect the baby, not to a degree enough to cause damage on their own. Which is why the model has two other factors that coincide.
You got it precisely right, Joe. Moving on to the next factor, which is the critical development period, which is typically seen as the first year of life. Even more specifically, the first 2 to 4 months of life.
What is so important about this developmental period that it could endanger the baby?
Well, as you may know, Joe, our brain uses much of its time in our childhood to fully develop all of its complexities. We're not born being able to talk and walk around. This stuff needs time to develop and be learned. It is much the same with growth and changes to breathing and sleeping patterns, which typically occur within the first year development, even more specifically the 2 to 4 month range.
You mentioned that specifically, the 2 to 4 months into development was particularly critical. Why is that?
Well, during this time period is where we see the highest incident rate of SIDS, which may be due to the drastic neurodevelopmental changes that are being undergone.
Is there anything that is changing developmentally that may be the culprit for higher incidence levels?
Well, so systems that are connected to homeostatic control see the most changes during this time period. So heart rate, breathing, and blood pressure are all things that are connected to homeostatic control. So when the systems are going through changes, it could interrupt vital functions like breathing, and on top of the other functions that can lead to SIDS.
So far, you have gone over these factors that it seems we have little control over. Please tell me this exogenous stressor is something we can affect. What even is an exogenous stressor?
Well, an exogenous stressor is more simply known as an outside stressor. These are things such as placing a baby on its stomach to sleep, clustering blankets around it, and using pillows and such with a child. So to relieve your concern, these are things that we have a significant amount of control over, Joe.
Glad to hear there is some light on the horizon. Now that each of the factors have been explained, can you put the whole model together for us and better explain why it is used today?
Yeah, Joe. So I believe it is easiest to see these factors as multipliers for the risk of SIDS. On their own, they don't pose much risk, but when happening simultaneously, they exponentially increase the risk of SIDS occurrence.
I'll use an example. Imagine there's an infant that has a genetic problem with its breathing or even its heart rate. While this does tax the infant's body at the time, it's able to overcome it. Then, say this is happening during its 4th month of life, where many developmental changes may lead the body to react in unusual ways, leading to instability, especially while the infant is sleeping. Even now, the baby may still be able to adapt until an outside stressor comes along, such as being placed on its stomach to sleep, taxing the infant even more. Now with all these stressors added simultaneously, the baby may not be able to breathe normally, leading to SIDS.
So is the model the latest information we have on SIDS? Or is there any research that has come around to challenge the model?
Well, there's little information to challenge the model as it does not give specific scientific reasoning for SIDS. It is best seen as a way to group reasons that are proven to be connected to a syndrome we do not know the direct cause of. That syndrome being SIDS.
All right, so since we have had this model since 1994, have there been any new, more specific findings?
Well, there is new evidence to say that I found abnormalities in serotonin levels and receptors in the brainstem of infants diagnosed with SIDS.
What is it that serotonin does in the brainstem that leads them to think it is a cause?
So whenever a neurotransmitter like serotonin, which carries information between the nerves, has imbalances, it can lead to changes in bodily functions, especially in areas such as the brainstem, which is crucial to functions like breathing, heart rate, and many other involuntary functions.
So what is stopping this from using this to prevent SIDS if we know it may affect the occurrence?
Well, the largest issue is that there's no safe way to detect these problems when the babies are alive, which makes them useless in detecting risk of SIDS in babies. Another point is that scientists that have worked on this say that it is unlikely that this occurrence alone is responsible for death. It is likely just one of the conditions that falls under the vulnerable infant risk factor of the triple risk model.
Since the model has been around for a while, have they added new findings to it?
The group that made the model proposed that SIDS risk factors could either be intrinsic or extrinsic, meaning internal or external, respectively. Extrinsic factors would be physical stressors appearing near the time of death, such as a baby being placed on its stomach while sleeping. Or intrinsic stressors could be a multitude of other conditions, with just a few being referenced above, but they only increase the susceptibility of the baby to experience SIDS, whereas the extrinsic stressor may be incorporated.
So the internal stressors make it easier for external stressors to affect the health of the baby.
Exactly. The team thought this was due to the very small number of cases where there was no extrinsic factor present. So on average, it seems the extrinsic factor may be the main cause of the issue.
We have talked quite a lot about the science and history behind this condition. What about the statistics behind its prevalence? You said the extrinsic stressor is a major culprit. Is there anything that we can do about it?
Well, so in 2022, according to the CDC, there were 3,700 unexpected infant deaths in the United States, with 1,529 of them being specifically from SIDS and the other 1,131 deaths from unknown causes.
But it's definitely still a concern today.
Certainly.
If I were to give birth to an infant today, what should I do to prevent SIDS or other unexpected deaths with my infant?
Well, if you were to give birth, Joe, the American Academy of Pediatrics has some recommendations to best reduce the chance of sudden unexpected infant deaths.
Let me guess, a nice cigar.
No, not exactly, Joe. Their first recommendation is to ensure a safe sleep environment.
What the hell does that mean? Do we barricade their crib and assign a guard?
Not quite, Joe. It does sound cool, though. This safe sleep environment includes putting the child in a supine position, meaning on its back, placing them in non-inclined flat surface, having them share a room but not a bed, and avoiding soft bedding or overheating.
I think some of those recommendations would help me sleep better too.
Me too, Joe, me too. Some additional recommendations made by the American Academy of Pediatrics to reduce the SIDS rate is the use of human milk feeding, avoidance of exposure to nicotine, alcohol, marijuana, opioids, and other illicit drugs, and providing routine immunization and checkups.
That's a whole lot. Can we break some of those down?
Of course, Joe. So we'll start with the most important, which is placing the baby on their back every time they sleep.
Why should we do that?
Good question, Joe. Starting in the 1980s, it started being recommended that babies sleep on their back. This was done due to the variety of evidence that the sleeping position is important in preventing SIDS.
How exactly does that help though?
So placing the baby in a supine position on a non-inclined surface provides a lower risk of choking and aspiration more than other sleeping positions due to baby's anatomy.
Jamie, can you pull up an example of their anatomy and how this helps? Ah, I see. So if they are on their back, they can't choke on their spit and breathe it in.
Yep, exactly, Joe. In addition to placing them flat on their back, placing them on a firm surface that maintains its shape helps decrease the chance of rebreathing.
How can I make sure the crib mattress is firm and safe enough for the infant?
Well, first off, the mattress shouldn't change shape around a baby's head. And pillows and cushions that are like this should not be used at all. Mattress toppers are also similar and dangerous to infants. Normal mattresses intended for older children and adults typically mold around the sleeper, so make sure to not let your infant fall asleep on these.
I see. Are there any recommendations for mattresses safe for infants?
Yes, there are. If you look at the Consumer Product Safety Commission, or CPSC, if you look at their website, you can ensure the product hasn't been recalled, which would obviously indicate it's dangerous for babies. This is important for cribs as well. When obtaining a crib, it is best to look at only new cribs, as used ones could be missing parts or broken, which could be harmful to the infant.
So to summarize, infants should sleep on their back on a flat, firm surface that won't mold to their shape. They should not sleep on adult mattresses or pillows, and be careful of used or broken cribs. Also, safety can be checked on the CPSC website by looking for recalls.
Yep, sounds like you got it perfectly, Joe. And this should be followed up until 1 year of age. It is also important to note that armchairs and couches are extremely dangerous for infants, and they should never be used for sleep.
What other sort of things are recommended?
Well, Joe, the next recommendation by the American Academy of Pediatrics is to breastfeed your infant instead of using other types of milk.
Well, I personally won't be doing any breastfeeding, but how can that help the infant?
Well, according to multiple studies, Joe, breastfeeding has been correlated with a reduced risk of SIDS.
Interesting. Maybe I will have to try it more.
I don't know if that's going to be really helpful for you and your baby, Joe. I think maybe leave it to your wife.
Are there any specifics involving how much breastfeeding should be done?
Well, they recommend feeding with human milk exclusively for the first 6 months of the infant's life, and then as much as desired afterwards. They also note that any breastfeeding is better than none, so the more the better.
What if you don't want to breastfeed or can't?
If you cannot breastfeed, alternative methods should be discussed with your physician so the best health for your infant is ensured. After breastfeeding is established, it is also recommended to offer a pacifier during both naps and bedtime.
Why is that?
Well, research shows that pacifiers provide a protective effect against SIDS, and it's thought that they help keep the infant's airway open.
Okay, so when would a parent know to start with the pacifier?
Established breastfeeding is defined as having sufficient milk supply as well as consistent, comfortable, and effective latch for milk transfer and appropriate weight gain. A physician can help with this as well.
All right, so we put the infant on its back to sleep on a firm, flat surface, and we breastfeed as much as possible and then introduce a pacifier. What else do they recommend?
So the next big recommendation by the American Academy of Pediatrics is for the infant to sleep in the parent's room close to the bed on their own surface for at least 6 months.
What is the point of this one?
Well, the statistics here are what decided this one. Obviously, we discussed that the infant needs its own space for sleep that is flat and firm. Going off of this, infants sleeping in a separate room are 2.75 to 11.5 times more likely to die suddenly than infants who are sharing a room with their parents without bed sharing.
That is a crazy difference.
Yes, agreed, Joe. The next important thing is to keep soft objects away from the infant while sleeping.
Would think that soft objects are safe.
Well, it appears that way. Objects like pillows, stuffed animals, quilts, comforters, mattress toppers, fur materials, loose bedding like blankets, and sheets can cause suffocation, entrapment, or strangulation.
Yeah, that wouldn't be good.
No, not at all, Joe. And the next recommendation regards something that the parent can do directly.
That be.
Essentially, the recommendation is to avoid drug use during pregnancy and after birth with both parents, as the infant can be exposed.
So I can't light up a joint with the kid?
That would not be a good idea at all, Joe. Smoke exposure, including from electronic cigarettes and vapes, is associated with higher SIDS rates. Even if the adult doesn't smoke near the infant, the risk of SIDS is higher when an infant shares the bed with an adult smoker than with a non-smoker.
So it's important to not smoke at all during pregnancy or after.
Yes, exactly. No cigars and no joints. Anything smoked or inhaled by the mother will also enter the baby's body during pregnancy, so that's a big no-go. The same thing goes for the use of other drugs, such as alcohol, marijuana, opioids, and other illicit drugs. There's an increased risk of SIDS when the infant is exposed to these substances, before birth and after.
It seems like we have touched on a lot. Are there any other recommendations?
Well, Joe, another big one is to avoid overheating infants.
How would someone do that?
The thing you want to consider here is that you should dress the infant no more than one layer than an adult would be comfortable wearing in that environment. Parents should also avoid overbundling, especially near the face and head. It is not recommended at all to place hats on infants indoors.
How would a parent know if their child was overheating?
Well, parents can observe the infants for sweating, flushed reddened skin, or the chest of the infant feeling hot, and you would know if you were to touch the baby, you would feel how hot they are.
Any last tips for preventing SIDS?
Well, Joe, some small things are to make sure that the infant is receiving prenatal care regularly and receiving their immunizations. These immunizations act as a protective factor against SIDS. Also, be careful of products that say they reduce the rate of SIDS, as these have likely not been proven.
I gotcha. Let's do a quick recap. If you were to summarize, how many big points would you say there are?
Well, Joe, I think there are 7 big themes we talked about today. Number 1, babies sleep on the back on a flat, firm surface all the time. No other objects surrounding them, even if you think that stuffed animal would look cute in a picture. Number 2, share a room with the baby, but do not share a bed. Number 3, if you can, breastfeed exclusively up to 6 months of age. Number 4, offer a pacifier at nap time and bedtime after breastfeeding is established. Number 5, avoid any form of smoking during pregnancy and alcohol and illicit drug use before, during, and after pregnancy. Number 6, avoid overheating your infant. Number 7, ensure the infant receives immunizations and goes to their regular checkups.
Well, that about sums it up. Hopefully this knowledge can help save some babies.
Of course. Thanks for having us on, Joe.
Thanks, Joe.
Thank you, Joe.
And Jamie, pull up our website on the screen. You can get a lot more information about us. And SIDS.